Recognizing that there has been a frightening surge in COVID-19 cases and deaths, four opposition MPs, Dr. Karen Cummings, Geeta Chandan Edmund, Tabitha Sarabu Halley, and Dawn Hastings Williams, have issued calls for the government to be more rigid in its approach to enforcing preventative measures. More importantly, the four women were heavy in their criticism of changes to the APNU-AFC's plan to dealing with the pandemic and have called for a reversal of some of those changes. The APNU-AFC, while still in government, had the opportunity to manage the situation for the first 5 months after the first case of the disease was detected here on March 11, 2020. In retrospect, Dr. Cummings now says that the only thing she thinks the coalition should have done differently was to be more oppressive with Port Health and lock down the country earlier. She says the PPP government must act with more inclusion and do like the APNU-AFC to recognize the need for involvement of all state agencies to combat the pandemic.
The point is this: it wasn't alarming as though it is now 438% in the cases and that sort of thing. It's very different, But we made effort, and by that time we would have continued our 4 E's, continue our testing and tracing, because we were at that point in time having assistance from Colombia and China in terms of PPEs from our Caribbean brothers and so forth. So we were on way to kind of contain it in some respects.
A former junior health minister herself, Dr. Cummings said the government is out of touch with the realities on the ground. She rejected the government's move to allow hundreds of citizens who tested positive for COVID-19 to home isolate, while the former Ocean View Hotel, which was transformed into a COVID-19 hospital by the APNU-AFC, continues to operate below capacity. Meanwhile, Chandan Edmund was strong in her call for the government to be far more rigid in enforcing the curfew and other preventative measures in place. She said the Guyana police force should be used to do its bid.
There has also been the absence of a coordinated effort at the enforcement of the regulations, and indeed bars, restaurants, and other establishments act with impunity and remain open during the curfew. Large numbers of persons still congregate, and many persons are seen in public without masks. All these create the opportunity for community spread of COVID-19. The Guyana Police Force, which is responsible for the COVID-19 enforcement operations, appears to have become devoid of leadership and direction in enforcing the measures. What we have seen since August 2nd is a relaxing of the enforcement. It is evident that the police have become politically instructed to stand down while COVID-19 is spreading at an alarming rate.
The government also received a flack for its move to have public servants return to work on a full-time basis and have been asked to give more attention to the spread of the virus in the hinterland communities, where the numbers are currently high. The opposition parliamentarians believe the government is too laid back in dealing with the virus and say if action is not taken now, there are fears for what could happen in the future. Reporting for the newsroom, Fariza Hanif.